Hi friends, welcome back to my YouTube channel. So first of all, please subscribe to my YouTube channel. Then coming back to our today's topic is acne vulgaris. In this video, we will talk about its type of acne lesions, causes and risk factors, hormonal therapies and treatment. So let's start the video. Acne vulgaris. Introduction of acne vulgaris is acne vulgaris is a common skin condition characterized by the appearance of pimples, blackheads, and other blemishes on the face, chest, and back. It is caused by the combination of factors including excess oil production, clogged pores, and bacterial overgrowth. So, this is the definition of acne vulgaris. Now, what are the causes and risk factors of acne vulgaris? Number 1, hormonal changes. Number 2, genetics. Number 3, stress. So, number 1, hormonal changes is fluctuation in hormones, particularly during the puberty, menstruation, and pregnancy, can increase oil production and can lead to acne breakout. Genetics. Individuals with a family history of acne are more likely to develop the condition, suggesting a genetic component. So, the third one is stress. High level of stress can trigger the body to produce more oil and which can lead to clogged pores and exacerbate acne. Now, what are the types of acne lesions? Number 1, comedones, blackheads and whiteheads, which are caused by the clogged pores. Number 2, inflammatory lesions, papules, pustules and nodules, which are characterized by the redness, swelling and pain. And the third one is cystic lesions, large, deep and blemishes that are difficult to treat and can lead to scarring. So these are the basic types of acne lesions. Now the diagnosis and grading of acne vulgaris. Number 1 is visual examination. A dermatologist will visually inspect the skin to assess the type of severity and acne lesions. Number 2, grading system. Acne is typically graded on a scale from 1 to 4, with 4 being the most severe. The third one is treatment planning. The grading helps determine the appropriate treatment approach, whether it's topical medication or oral therapies. So basically, acne is measured by grading, which is from 1 to 4, whether it's being severe or mild. On the basis of the grading, we will diagnose the treatment. Now the next one is topical treatment. Number 1, retinoids, prescription creams and gels that help unclog pores and reduce inflammation. Number 2, benzoyl peroxide, an over-the-counter medication that kills acne-causing bacteria and dries out pimples. Number 3, antibiotics, topical antibiotic solution that help reduce inflammation and prevent new breakout. Number 4, salicylic acid, a chemical exfoliant that helps unclog pores and prevent the formation of new acne pores. Now the next one is oral medication. Number 1, antibiotics. Oral antibiotics can help to reduce inflammation and kill acne causing bacteria. Second one is hormonal therapy. Birth control pills and anti-androgens medication can help to regulate hormones and reduce acne. Number 3, isotretinoid, a protein oil retinoid that can effectively treat severe and cystic acne. And the most important is hormonal therapies. Number 1, androgen regulation. Hormonal therapies work by regulating androgen level, which can reduce the oil production and prevent care. Number 2, birth control pills. Certain birth control pills containing estrogen and progestin can be effective in treating acne in women. The third one is anti-androgen medications. Spironolactone and other anti-androgen drugs can also be used to manage the hormone acne. Now the next one is procedural intervention. Number 1, extraction. A licensed professional can manually remove blackhead and whitehead to clear clogged pores. Number 2, chemical peels, treatment that can use acids to exfoliate and enlarge pores, reducing the appearance of acne. The third one is light therapy. The use of specific wavelength of light can help to kill acne-causing bacteria and reduce inflammation to clear the skin. And the last one is lifestyle modification and prevention. Number 1, stress management. Practicing stress reducing techniques like medications, yoga, and exercises can help to prevent acne breakout. Number 2, skin care routine. Gently cleansing, moisturizing, and using non-comedogenic, non-poring clothing and products can help to maintain healthy skin. And the third one is most important is dietary changes. Avoiding certain foods that may trigger acne, such as dietary and sugar products, can help prevent breakouts. So this is the complete lecture of acne vulgaris prevention and its lifestyle modification. I hope you guys like the video. Please share with your medical friends.